Hi, my name is Farrah Nicholas. I'm with Hattiesburg campus. I'm doing my infection control video, but first I'm going to start with my isolation precautions. I just want to say that with all isolation precautions, if you're expecting a splash or anything that can project out from the body, then you want to make sure you're fully covered with the gown, the mask, the goggles, and the gloves. But I'm going to start with talking specifically about airborne precautions. So with airborne precautions, you're going to have an N95 mask. It needs to fit securely to your face, so you're going to be fit for that. When you start on a unit, they're going to be in a negative pressure room, and you always want to make sure that the patient's door is closed with these airborne precautions. You're going to be using airborne precautions with patients that have tuberculosis, measles, or varicella. So it's very important, like I said, make sure that door is always closed, and you get fitted for that N95 mask. Next, we're going to talk about contact precautions. You're going to use contact precautions most of the time, a lot of the time. If a patient's having wound drainage, fecal incontinence, anything like that, you're going to be using contact precautions. So you're always going to wear gloves and gown with contact precautions, and you may need the mask and goggles, if you're expecting a splash, things like that. Next, we're going to talk about droplet. So with droplet, you're going to have on your mask and your gloves. You don't need an N95, but you do just need to have a mask on and your gloves. And like I said, anticipating a splash, gown and goggles. You're going to use this for pneumonia, rubella, and mumps. The last one we're going to talk about is protective isolation. This one's going to be used a lot with your cancer patients. So if they're on chemotherapy, because their immune system's down, if they're on immunosuppressive meds, or if they're neutropenic. So this is when you're going to be using those precautions, and basically the patient is going to be wearing the equipment. So the patient's going to be in a mask. Me as a nurse, if I'm around that patient, I'm going to be wearing sterile gloves and gown. Also, you're going to make sure the patient is avoiding fresh fruits and vegetables. They always need to be cooked through, and fresh flowers. And you're probably going to be limiting visitors as well. So next, I'm going to wash my hands and show you the proper technique for that. I'm just going to set these right behind me. Okay, so first, if I have any jewelry on my hands, remove that. I don't have any, but if I did, I would remove it. If I have on a watch, I'm going to push it up to the upper forearm. Turn on my water. It needs to be warm. And so once that's warm, I'm going to just kind of wet my hands and get some soap on my hands. Sorry. So I'm going to start by scrubbing my hands. I'm going to go up to the forearm. And I'm going to do this vigorously for 15 seconds. As I'm doing this, I'm going in between the fingers. I'm going to go like this to get under my fingernails, and just go like this with each individual one to make sure I'm getting all the germs, and just keep enough clean as I can. So just going to do this for 15 seconds, like I said. Okay, and so after that 15 seconds is up, I'm going to go like this. I'm going to rinse the soap off. And as you're doing this, you want to make sure that you're not touching the sides of the sink. I know from the angle it may look like I am, but I'm not. You don't want to lean your hands or wave your hands back and forth. You're going to leave them pointed down. And then grab a paper towel. And then pat dry, just like this, going down. Then you're going to throw that away. And then you're going to use a fresh paper towel to turn the water off. Like that, throw that away, and that's